sparing and antihypertensive agent. One of those thiazide is called hydroton. It's a very long-lasting medication where you give it and you only have to give it every 3 days. Again, we have thiazide-like medication because of the place within the kidney where it does its action. We have loop diuretics. Again, they generally happen within the loop of Henle. One of your most popular ones is Lasix or furosemide. Laboratory change with loop diuretics, as you can see, pretty much like the other one, isn't it? You have pretty much the same kind of alterations in blood chemistry with this diuretic as we do with the other one. One thing we'll see is an elevated BUN and creatinine. You need to understand or to keep your mind on those as you go through this program or as you are a nurse. BUN and creatinine help determine what? Kidney function. Exactly, kidney function. So when these become elevated, then we have an issue with kidney function. Okay. Kidneys were made to spit out salt and water. That's what they're made to do. Okay. But now, because we're getting rid of water, other chemicals go along with that. We have potassium that goes out. We have chloride that goes out. You can have sugar in there that goes out. All these things go through the glomerulus and cause damage because the holes aren't big enough to handle these. And this is one way to, or the primary way to determine the function of the kidney is through that blood work called BUN and creatinine. Questions? And as you can see here, it does the same thing, but it works a little bit differently. Where the action expands the extracellular fluid and plasma volume and inhibits reabsorption of water in the loop. So it causes excretion of water through osmosis versus through our action of sodium. But we're doing the exact same thing, and fluid and our electrolyte balance, like with the other ones, is still apparent. Those things need to be understood that we're helping the individual. But you have to understand that we're getting rid of fluid and electrolytes, which are important for the body to work. And if they're thrown off balance too much, then we start having other issues. Like potassium, if it goes down too far or goes up too high, we have cardiac events. The side effects are almost exactly the same, whichever direction you go. We have too little sodium, too little chloride, we start having issues with muscles. We have seizures, we have other issues with the nervous system. Are we good? And then we have carbonic anhydrase inhibitors. And all it does, it inhibits the rapid conversion of CO2 and water to HCO3. So therefore we are slowing down the process of converting this over and then are able to get rid of the excess water. And again, we're doing very much the same thing as we did before. All these medications have one purpose, that's to get rid of excess water out of the vascular system so the heart beats more effectively. Questions? You guys are right on the ball, or you've had too much lunch.
I have a question. You said that when you're diuretics, that's when you will see elevated bone and creatinine levels?
That is one of the times you will see that. It's not the only time.
Right, but that's, so you're not.
Okay. But what that tells us is that if you're taking diuretics and we're having this alteration in BUN and creatinine, what that's telling us is, okay, now we're causing damage to the kidneys, and we have to watch that, and that now our mode of medication may change in order to prevent further damage. Okay? And we have potassium sparing. These are medications that release sodium, but they retain potassium. And as you can see there, that's your information. Questions? Why don't we take a 10-minute or 15-minute break, and we'll come back and we'll start on antihypertensive. So be back at the top of the hour.